So I was just asked a really great question about how is it possible that we have 4 different types of fraxel lasers. So fractional is a phrase that relates to the overall technology of only treating the skin a fraction of the space. So let's say usually it's a 25 to 30% fractional coverage. The core, which is a Candela product, it's a CO2 fractional. That can go up to 50% fractional coverage. So the higher the fractional coverage on the core, the more intense the treatment is. And that blends different depths. So you can go from a light peel all the way to fusion, which is a combination of pigment improvement and dermal improvement. So that's core, that's one fractional that we have, and that's CO2, so that's literally vaporizing tissue. But that's usually one treatment does it. That's the great thing about that. And then we have something like this, which is the clear and brilliant, and that I refer to as like a baby fraxel. So that's a fractional laser that uses either a 1927 nanometer depth, which is actually very superficial, or 1440. 1440 and 1927 relate to the depth of the treatment and how deep it goes in the skin. And this one has dual, so you can do the same dual depths at the same treatment, or most of our patients, because they don't want downtime, we just do one. The 1927 relates to the pigment improvement, and the 1440 helps with collagen. Okay, so that's clear and brilliant. The baby fraxel, excellent starter laser, excellent for patients that don't want any downtime at all, and really great if you want improvement on pores and fine lines and wrinkles. The third fractional laser that we have is the peak away laser. So the peak away laser has, in fact, the resolve handpieces on them, and the resolve handpieces are another dual depth. We have 532 nanometer, which is for pigment, and we have 1064 nanometer, which improves the collagen of the skin, and it rotates the water molecules, it heats up the water molecules. So the peak away, when I do a resolve laser facial, I'm always doing dual wavelengths, and so the patient is getting a fractional. We're only treating part of the skin in any treatment, so they do need 3 or 4. And what makes it amazing and special is we're using pico energy, which is sound waves, not thermal energy like the CO2 or the clear and brilliant. It's sound waves, so the sound breaks up the skin cells, and there's a lot less downtime. It's pico, so it's faster than millisecond and nanosecond, so it's super fast. And it's, when we do the resolve, it's a 3D holographic laser. So that means it lays down 101 evenly spaced, evenly applied LIOBs, laser-induced optical breakdowns. All right, is everyone still following me? The fourth fractional that we have is sublative fractional radiofrequency. Sublative is radio frequency applied in a fractional technology. So there is a little bit of downtime, but it literally tightens up the pores. It really is a cool treatment. 3 to 4 treatments, 1 treatment a month on that one, and that's using radio frequency, so there's not a light, so to speak, a surface light like what we're used to when we think of lasers. I hope that helps. If you have any questions, hit the like and the comment button, hit the share button, come visit us at Schaefer Plastic Surgery. Dr. Schaefer has a ton of YouTube videos as well. And if you want to reach out, just call the office for any more details. Thanks.